For me, diabetes is personal. I've had type 1 diabetes for 20 years. Listen, when I'm home taking care of myself, diabetes is at the top of my mind. I'm thinking about it every minute of every day. God forbid I come to the hospital, that worry, that fear, that concern doesn't go away. In fact, it's heightened. If you have diabetes and you're admitted to Stony Brook, it doesn't matter where in the institution you're receiving your care. We can guarantee that you receive the same exceptional care to manage your diabetes anywhere housewide. Our diabetes program started about 4 or 5 years ago. The program is built on 3 major components. The first is IT and analytics. The second is diabetes education. And the third is standardization of order entry and policies and procedures.
Because the scope was so large, we were essentially looking at 7,000 patients per year. And we were starting from a current state that was very bare bones and re-engineering the entire process.
We worked very closely with the IT team to develop glucometrics, which really was the lifeline for the opportunity for us to improve performance. It provides real-time data and allows us to be able to change performance patterns in order to improve on a dime.
Without what we've done in the space in IT, we would not have been as successful as we currently are.
There was extensive education and training and requirements for understanding and learning the protocols. And then with the use of glucometrics, we were able to determine whether or not those educational processes took hold.
In relying on the ADA standards, we overhauled the entire house, all in support of changing the culture around diabetes care at Stony Brook. If a patient tells me, I was here in the hospital for X, but you did help to address my diabetes needs while we were working on that problem, that's a meaningful outcome to me.
As a result of reviewing data, we were able to reduce length of stay and better control patients with diabetes in terms of their glucose levels.
We have to date one of the largest sign-in sheets you're likely to see, and it's because of active participation for every facet of care that surrounds diabetes. Satisfying to see a team operate so smoothly on so many levels, so many aspects of care.
With Dr. Miller leading the way and working with our quality team and all of the other disciplines together, there wasn't anything they couldn't accomplish. I believe that the success of this initiative is the fact that if you ask the governing body what our organizational priorities are, he would clearly be able to articulate them just as clearly as the bedside nurse.
Everyone moved towards a common goal, and it's that journey together that's proven the most successful and the most transformational for Stony Brook.